Strokes are among the leading causes of death and long-term disability worldwide, often striking without warning and leaving devastating consequences in their wake. However, what many people don't realize is that the body can sometimes give off subtle clues days or even weeks before a stroke actually occurs. Recognizing these early warning signs could mean the difference between life and death, or between full recovery and permanent damage. While strokes are commonly associated with older adults, they can affect individuals of any age, including those who appear otherwise healthy. That's why it's critical to understand and respond to these signals promptly. Below, we explore 7 early warning signs of stroke in greater detail, symptoms that should never be ignored. Number 1. Persistent high blood pressure, hypertension. High blood pressure is often called the silent killer because it typically doesn't cause obvious symptoms, yet it significantly increases the risk of a stroke. When blood pressure remains consistently high, it puts excessive pressure on the blood vessels, especially the delicate arteries in the brain. Over time, this can cause them to become narrowed, weakened, or even rupture. If a vessel bursts, it can lead to a hemorrhagic stroke, while restricted blood flow from damaged arteries can cause an ischemic stroke, the more common type. Because high blood pressure often goes unnoticed, regular monitoring and proper management through lifestyle changes and medication are vital for stroke prevention. Number 2. Extreme fatigue. Feeling unusually exhausted for no apparent reason can be an early and easily overlooked warning sign of an impending stroke. While fatigue can result from many everyday factors like stress or poor sleep, extreme and unexplained tiredness might be a red flag. This could signal that the brain is not receiving enough oxygen-rich blood due to partially blocked or narrowed arteries. In some cases, this fatigue may be related to a transient ischemic attack, TIA, also known as a mini-stroke, which is a temporary blockage of blood flow to the brain. A TIA is a serious warning that a major stroke could occur in the near future and should be treated as a medical emergency. Number 3. Dangerous vision problems. Sudden or unexplained changes in vision, such as blurred vision, double vision, or partial loss of sight, may be an early sign of a stroke, especially if they affect one eye or one side of your visual field. These symptoms can result from reduced blood flow to the parts of the brain responsible for vision. In some cases, a blocked artery to the eye may cause vision loss, which is a type of ischemic stroke. Because vision issues are often attributed to fatigue, eye strain, or aging, many people ignore them. However, any sudden visual disturbances should prompt immediate medical evaluation. Number 4. Sudden severe headache. A sudden, intense headache that strikes without warning and feels unlike anything you've experienced before can be a critical warning sign of a hemorrhagic stroke. Often described as a thunderclap headache or the worst headache of my life, this type of pain is typically sharp, explosive, and comes on rapidly. It is usually caused by bleeding in the brain, often the result of a ruptured aneurysm, a bulging, weakened blood vessel that bursts under pressure. When this happens, blood spills into brain tissue, raising intracranial pressure and damaging nearby brain cells. In addition to the severe pain, people may experience neck stiffness, nausea, vomiting, vision disturbances, confusion, or even loss of consciousness. Because this type of stroke progresses quickly and can be fatal within minutes or hours, immediate emergency care is absolutely essential. Never assume a sudden, extreme headache is just a migraine. Always seek medical evaluation right away. Number 5. Numbness or weakness in the limbs or face. One of the most well-known and easily recognizable signs of a stroke is sudden numbness, weakness, or paralysis, often affecting the face, arm, or leg on one side of the body. This occurs because a stroke impairs blood flow to the area of the brain responsible for motor control and sensation. If that part of the brain doesn't receive adequate oxygen and nutrients, it quickly begins to malfunction, leading to physical symptoms. You may notice a drooping face, especially when trying to smile, a heavy arm that can't be lifted, or a leg that suddenly feels unstable. These symptoms often occur during a transient ischemic attack, TIA, also known as a mini-stroke, where the blockage is temporary. But even if the symptoms go away in minutes, they should be treated as an emergency. A TIA is a major warning sign that a full stroke may follow within days or even hours. Prompt evaluation and treatment can help prevent permanent brain damage and save lives. Number 6. Serious speech problems. Sudden trouble with speech is another hallmark sign of a stroke. This can include slurred speech, difficulty finding the right words, inability to form coherent sentences, or even difficulty understanding others. These issues are often the result of damage to areas of the brain involved in language processing, typically in the left hemisphere. This condition is known as aphasia, and it can appear in various forms. Expressive aphasia makes it difficult to speak or write, while receptive aphasia affects the ability to comprehend language. Sometimes people experiencing this symptom aren't even aware they're speaking incoherently, which can be alarming to those around them. If someone suddenly starts to mumble, uses inappropriate words, or struggles to understand simple instructions, act fast. This may be one of the earliest signs of a stroke in progress. Call emergency services immediately, as every moment without blood flow increases the risk of irreversible brain damage. Number 7. Subtle neurological symptoms. In some cases, the brain may exhibit more subtle, easily dismissed signs that something is wrong, especially in the days or weeks leading up to a major stroke. These early neurological warning signs may include unexplained memory problems, dizziness, sudden confusion, loss of coordination, unsteady walking, or difficulty with balance. Others may experience nausea, unexplained vomiting, or even brief episodes of vision loss. While these symptoms can be linked to other conditions like migraines, vertigo, brain tumors, or inner ear infections, they shouldn't be ignored, especially if they're new or unusual for you. In some cases, these signs are due to tiny clots or narrowed arteries disrupting small areas of the brain, causing microstrokes or TAs that don't leave permanent damage, but serve as critical warnings. If you notice yourself or a loved one experiencing any combination of these symptoms, don't try to self-diagnose. Seek medical advice immediately, preferably from a neurologist, to rule out stroke-related causes and take preventive action if needed. While the 7 main warning signs of a stroke are crucial to recognize, there are also some lesser-known symptoms that can serve as early indicators. These signs may not always be as obvious, but paying attention to subtle changes in your health could make all the difference in preventing a devastating stroke. If you notice any of these additional signs, don't hesitate to seek medical advice. Early detection and action are vital in minimizing long-term damage and improving outcomes. Here are a few more bonus warning signs to keep an eye on. Bonus 1. Sudden trouble swallowing, dysphagia. Difficulty swallowing, medically known as dysphagia, can occur suddenly when a stroke affects the parts of the brain that control the throat muscles. This symptom is often dismissed, especially if it seems mild or only affects the ability to swallow liquids or pills. However, it's a red flag that should never be ignored. Dysphagia can lead to aspiration, where food or liquid accidentally enters the airway, increasing the risk of pneumonia and choking. In stroke cases, it can also indicate damage to the brainstem, a vital area that controls basic bodily functions like breathing, heartbeat, and reflexes. If someone suddenly coughs or chokes while eating or feels like food is stuck in their throat, don't wait, seek emergency care. Bonus 2. Sudden mood or personality changes. A stroke can sometimes cause abrupt mood swings, emotional instability, or even personality changes before more physical symptoms appear. This is especially true when the stroke affects the frontal lobes, which regulate emotions, behavior, and decision-making. A person may suddenly become irritable, anxious, depressed, or confused without any obvious cause. In some cases, stroke survivors have reported feeling inexplicably sad or angry in the days leading up to the event. Loved ones might notice that the individual seems off, or is acting strangely, perhaps being uncharacteristically aggressive or withdrawn. While changes in mood can be related to many conditions, if they occur alongside other neurological signs like fatigue or imbalance, they may signal pre-stroke brain dysfunction. Bonus 3. Hiccups or chest pain, especially in women. Unusual symptoms like persistent hiccups, shortness of breath, or chest pain are rare but recognized as stroke warning signs, particularly in women. These can happen when a stroke affects the brainstem or autonomic nervous system, which manages involuntary actions like breathing and heartbeat. Because these symptoms are not classically associated with strokes, they're often misdiagnosed or ignored. Women may also experience jaw pain, nausea, or general weakness during a stroke, symptoms that are more easily mistaken for other issues like acid reflux or anxiety. If these signs appear suddenly and without explanation, especially alongside dizziness, confusion, or weakness, they should be treated as potential stroke indicators.